In Farmington, we do a lot with addiction. We have quite a few behavioral health services. We have outpatient counseling for families, for individuals, adults, children, people with mental health issues, or people with substance abuse, or both. We have case management so that people who need help with housing or money or any of those kinds of budgeting things. And we have drug court and community corrections, an intensive outpatient program that we run with TOTA jointly, which is a very exciting program, and is now also partnering with the county and the meth treatment program there.
Within this community, we do have residential treatment at Four Winds. Okay. Then there's also intensive outpatient through Four Winds. There's also the 60-day meth pilot program, the DWI, which is residential. Then at both facilities, they both offer intensive outpatient and also individual counseling. And also they can get medical services. They also can receive individual counseling, group counseling.
If somebody was seeking treatment or recovery and they came to Four Winds, what they would need to do is first and foremost, they would need to have an assessment done. And the assessment is to determine their level of the seriousness of their problem with substances, take a look at really all aspects of their lives, and to take a look at what damage has been done, what has led up to the addiction in their life, take a look at things like support system, and also it's to tap into their strengths, identify their strengths, so you can use those to help them get back on track. Once they finish the assessment, if it's determined that residential treatment is going to be helpful for them, then what we would do is get them on a waiting list, try to get them into intensive outpatient treatment while they're on the waiting list, and then once they come in for residential treatment, they can stay anywhere from a week for however long. They can stay 6 to 8 weeks if necessary. The average still is 28 days.
Okay, the Meth Pilot Project is a 60-day inpatient residential treatment program for methamphetamine. We treat women who have been identified through the court system, either through CYFD or the criminal courts, as having a methamphetamine problem. And they're here for 60 days. The 60-day program, the inpatient portion, is followed by a 4-month intensive outpatient program, and then that is followed by about 8 months of aftercare. So it's about a 14-month commitment altogether.
At the Oasis, we offer a 12-step program. We also have a concerned persons group. That is for a person that doesn't have a problem, but someone who's dealing with a loved one or someone who has a problem. All of our programs are faith-based. Our 12-step program is a 12-step program that's Bible-based, and it is for anyone with any kind of a life-controlling addiction.
Through our church, people will understand that we do have a Christian recovery home available here. It's free of charge, and like I said, it's a humble place. It's a double wide trailer, you know what I'm saying? But you gotta understand that the individual's tired, you know what I'm saying? Tired of being in that lifestyle. I mean, and if he's willing to come and surrender his life to the Lord, it doesn't matter where he stays, because he's at that place.
Come down, talk to us, see what we're doing in person. Let us tell you about ourselves. Recovery is very possible. Let us tell you what we're doing here. Not every agency is a perfect match for every addict, every alcoholic. There are different types of agencies. Visit the agencies, talk to them, feel them out, be honest with them. They will be honest with you.